another penny later.
Okay. Looking forward to it.
Right. So it's 8:33. Let's switch gears a little bit, and this is something that you were really interested in. I think it's pretty cool too. It's this small school study they conducted at the Japanese School of Guam from the governor's physicians advisory group. I'll bring on Dr. Michael as a pediatrician who you kind of like led this study, right, Doc?
Or project, pilot project.
Yeah, pilot project.
Well, I didn't really lead it, but yeah, the educational subcommittee helped the Japanese school get their guidelines together.
Right.
And so initially after the first couple weeks now, what we've seen so far has been very encouraging. It looks like the kids have kind of gotten used to all the safety and hygiene measures. Hasn't proven to be too cumbersome for people. And it looks like now they're kind of getting back into the swing of things, and I guess we're seeing what the new normal is starting to look like. There's definitely been some lessons that we've gotten, some good takeaways that we've got away from this. Chief among them is that while most of the parents were quite okay with the safety measures that were put in place, there were a small percentage that were on either end of the spectrum. Some thought it was too lenient, and some thought it was not enough. And so what the Japanese school mentioned was that how the importance of communicating with the parents and the kids. They were already, I think, had some meetings and set out some notices, but to really explain to them what to expect on that first day, and maybe even have, if they could do it again, maybe even do like a walkthrough for the parents and the kids to really see what everything was about. Some other things were there. I guess they have some annual events that the kids really look forward to. The one I heard about was a big pool party for the whole school, and of course, that's not really something that's feasible right now, but the kids didn't know that was going to be taken away from them. So setting expectations early might be a very important step for that. And then one really important thing that I was surprised when I first heard about it, but it really made a lot of sense, was that initially the kids and staff were getting more tired, and especially as the day went on, they seemed to be, less engaged. And, you could attribute a little bit of that to they had a long break, and now they're kind of back in school with these kind of longer days. And, maybe the mask in class was kind of making them, a little distracting them. But there were some anecdotal reports that some of the students were showing some signs of elevated stress and anxiety. And this is kind of an important thing that I think often gets overlooked. And I think the AP really, the American Academy of Pediatrics recently put out a thing on school guidelines too, talking about the mental health aspect for kids. And so I'm sure most kids will do okay, but there's definitely going to be some kids who have a higher level of stress with kind of everything that's going on. And this would be a good opportunity while we're still waiting for school to open for parents to sit down, talk with their kids, and just see what kind of questions or fears that their children might have, just so they don't feel too anxious or nervous when they're finally leaving the safety of their home, the usual routine they've been having or no routine for the past few months, and then getting back to school with the environment that they haven't been used to in a while.
Doc, can you just take us back? How many, what was the sample size? How many students are we talking about?
Oh, so the Japanese school has about 60 students.
Okay.
Mm-hmm.
And how did this work? So you monitored all of the classes, and what were some of the things they did? Like they put up plexiglass. I'm just not real familiar, and they were required to wear masks in the classroom, but not during recess.
Mm-hmm. So what they did, so let's see, starting from the beginning, they would, as the kids got dropped off, they would have staggered drop-off times. They would be greeted by a staff member up front. They get the temperature taken, showed their symptom checklist sheet. And then after they go in, and for visitors or anybody else that wants to check in, there would be a separate office entrance that, with plexiglass and sign-in sheet and hand sanitizers. And then in class, the Japanese school opted to wear masks during class for all the kids. And same with the teachers. And they also put in some sinks. They had some outdoor sinks that I believe weren't in use, but they fixed them up. And so outside of the bathrooms, before they go in, they wash their hands. When they come out, they wash their hands. Having it outside makes it easier for people just kind of monitor them. Of course, they're obligated to wash their hands like before and after eating, etc. On the playground, I think they weren't mandated to wear masks if they didn't want to. I think a lot of some parents felt much more comfortable if they did. So that was something that came up, and some parents were, just had a lower threshold on what they were comfortable with. And for the first 2 weeks, they actually started with a shorter school day, and I think that was very instrumental in helping them kind of ease into it and get the kids used to it.
And how long were they in school? How long were you monitoring them? For 3 weeks?
Yeah, so far, so they've been back. They must have just finished their 3rd week of school. We weren't monitoring them like daily, like we weren't going there watching, but we did check in weekly with the Japanese school to see how things were going. What could be better, what would they change.
What are the takeaways that we're looking to apply from this experience and apply them to other school reopenings that we're looking at happening in the very near future?
So the big thing is, and DOE and the other school and the Catholic schools and private schools have already been doing this really well, is that planning is just so huge to really just thoroughly sit and plan and try to anticipate everything that can come up. Overall, I was pretty impressed that there weren't major hiccups with the pilot study, but then again, there were hours and hours and several meetings to try to figure out like what could work. And this was for a relatively small school, so with the bigger schools, it's just going to be that much more important to figure out the nuances of how to implement like our overall safety guidelines that come out. And then of course the communication between parents and with the parents, students, and the schools is going to be of utmost importance.
And again, these kids, they don't ride a school bus, right? They are dropped off by their parents to school.
Yes, I think they had a very small percentage that last year might have taken school bus, but no, for now, all these kids were being dropped off at school.
Is that some of the discussions the physicians advisory group is having regarding children that are going to be, riding the school bus? How are they going to maintain social distancing?
That's
seems
something that DOE's
really
already kind of, thought of. And yes, it's going to be difficult with the school buses. I know DOE has thoughts in mind about splitting up their school schedule. I'm going to leave let them give you the specifics of. But if that's the case, then you're only going to have a fraction of the kids actually being present in class, and that'll kind of relax some of the closeness on the school bus for a lot of these kids. So
and not only the closeness, but when we last spoke with Jess, they were still trying to figure out if they were still going to use these school buses to transport people to government quarantine facilities.
Oh, well, I don't know about how they're going to actually utilize school buses, so sorry.
No, it's okay. So was there anything else about the findings of this pilot project? Is this the only school? I know we talked about the Sylvan Learning Center. Is this the only one that you guys have been monitoring? Or
yeah, so this was the only school that was in the pilot project. We decided as a group yesterday at our meeting to recommend to the governor to allow like the commercial learning centers to kind of open up looking at this.
Like tutors and stuff?
Yes. And so we're still pretty confident that definitely with the smaller schools, it should be relatively easy to implement and not be difficult for students and teachers to get used to it. It'll just be a bigger challenge just due to the sizes of the bigger schools.
What about anything else from a pediatric standpoint relative to COVID-19 outside of the school study? Because we really only recently folded you into the conversation. So I guess just from a pediatric standpoint relative to COVID-19, what are some of the key things that parents need to know and remember?
The first thing is overall, kids who are over the age of 1 and before they get to their teenage years seem to do well with COVID just around the world. So I see parents that understandably get very nervous about taking their kids out or seeing other family members. And overall, it's important to realize that they're going to be pretty okay. Of course, you hear the scary stories out stateside and elsewhere about some younger person that felt really ill, but overall they do okay. With COVID, I've seen a couple kids who were tested positive, and I was just amazed at how well they appeared. The story was something along the lines of, they didn't really have a fever, they had a cough, maybe threw up once, but when I saw them, they were running around. Nobody would look at the kid and say, "Oh, yeah, that kid, there's something going on." Right. Secondly, the mental health issue. Mental health is, a lot of people kind of shy away from the term, but just to address like the stress, any fears is something that kind of gets overlooked because we're stressed out right now. We're kind of anxious of how everything is going, but the kids definitely pick up on what the parents are feeling. And so I've seen kids in clinic that act just a little more, I don't know, maybe a little more jittery, a little more nervous in clinic than I've seen in the past. And so that's something that's kind of new and kind of raised my antenna a little bit.
Right. Doc, I'm going to give you an example of that. So, like my younger kids, when we go around, so, over the weekend, they really wanted to go to the beach and go swimming, and we stayed, it's like 2 minutes away from one of the public, it's not a public park per se, but it's a public beach, first beach in Epen. So we drove over to swim, and man, there was just like, it was crazy. There were about 30 cars, and I want to say 6-7 different groups of people. Just it was nuts. And my the 5-year-old goes, "God, Dad, don't these people know about coronavirus?" So they're taking it serious, and they're actually not. And when you mention the anxiety and the stress, it is hard to read in little kids, but all of a sudden, it's like all these little children had to worry about life and death matters, about, mom and dad or grandma and grandpa getting sick and dying, and they see the news, they see it. They see the national stories, they see, the local stories. So you're right. I think a lot of us maybe not shy away, but just can't really wrap our mind around how this anxiety and this stress is affecting kids who we, as adults, automatically assume are just so resilient and they can just go through everything. So how do you talk about that with your kids?
One thing is, to help parents kind of recognize what some of the signs of stress you might see in kids would be. So a lot of times kids are going to manifest stress with abdominal symptoms. Like when you're little and you don't want to go to church and you're like, "Oh, my belly hurts," that's a sign of stress right there. If you see any sleep disturbances, any regression in behavior, those are going to be signs that, maybe you should start and ask them. Easiest thing is just ask the child, how are you feeling? What's going on? Are you worried about anything? And just kind of open a dialogue. It's not going to be one conversation that kind of ends their stress and anxiety, but as long as I think the child knows that they're being listened to and getting some reassurance from the parents, right? Because you're absolutely right. They pick up on this, and kids are really good at understanding the rules and frameworks that they're given. So if you as a parent tell them, "Hey, you cannot touch anything and you always have to wear this mask," well, when somebody comes up and wants to touch them, or you ask them, "Oh, it's okay, take off your mask," the child's going to feel a little like, "Hey, wait, my parents told me like I have to do this, and now I don't have to." It can get confusing for them.
Right.
Yeah.
And then as parents right there, so the anxiety, the stress that caused the mental thing, and then could they manifest into physical symptoms? Like what they do with adults, right? So when we're under stress, I mean, God, there's like hypertension, there's all these things that could happen. What about with kids?
Yeah, so mostly the physical stuff is going to be their behavior. So like sleep disturbances, maybe they're acting out a little bit more. And then if they say any bodily symptoms, it's usually going to be like the abdominal symptoms, so like belly pain.
I got you.
Yeah.
Have you, on the physician or anyone on the physicians advisory group, what communications have you guys been having with the Guam Department of Education? Because I do see and have heard from DOE officials that, part of this education stabilization funds that they received, I think it was like $40-some million, that part of it is going to go to emotional and behavioral wellness support. But have you guys had brought GDOE into any of the discussions that you guys have been having?
Oh, yeah. GDOE actually brought us into the discussion. And
Nice.
Actually, really early on, I was really impressed with, I think John Fernandez mentioned early on that they already anticipated that kids were going to have some issues with, maybe stress, even the social isolation, right? So they were already planning to beef up their, behavioral services. And I really applaud him for that. It was, as a pediatrician, I was really happy to hear that. We've been involved with some meetings for them. We looked over the guidelines that they put out and give our feedback. We want to let them know that we're available as a consulting body. Because now that they have the big guidelines, their task is going to be to actually figure out how to implement and operationalize it for each individual school, which is going to be a very challenging task indeed. But yeah, we have meetings regularly, and I'm actually going to be emailing our lessons learned from the Japanese school out to them later this morning. You guys just got a sneak peek of.
Okay, maybe you could put our names on that email too. Would be great. Sabrina at KUAM.com.
Right, yeah. Better put Sabrina's name.
Anything else? I know you said you talked to GDOE. What about with the other private schools?
There was a meeting. There's a joint meeting with the private and charter schools and GDOE together. But I was only in with the first introductory meeting. I think they're going to still work on their separate guidelines. But we've taken a look at some of the guidelines from the other schools that they just kind of sent to us to kind of look over. Mm-hmm. But I haven't seen anything final from any of the private or charter schools yet. But then again, they don't necessarily have to come through us for approval. Public health will give the final approval. But right. If they wanted us to just kind of look over and give our thoughts on it, we were happy to do so.
All right, Doc. Well, we just wanted to bring you on. And then, as schools start to reopen, I think you provide a pretty cool perspective as a pediatrician. It's a kind of a viewpoint we haven't really had on the show consistently. So we hope we'll be able to talk with you more frequently as the opening of schools gets closer.
Yeah, happy to do so.
Right
Thanks,
on, Doc.
Dr.
Thank you. And then, Dr. of course, you're from One Love Pediatrics, right? And you got a Facebook page and all that.
Oh, yeah. One Love Pediatrics, that's it.
Right. Okay, thanks, Doc.
All right, thanks, guys. Have a good day.
Wash
You
your
too.
hands.
Wear a
Always.
mask.
Okay, good. 8:51. A good talk there, Bree. It's pretty interesting. That school study.
Yeah.
It's 8:51. We had Sergeant Paul Tapau from the Guam Police Department coming on in a few minutes. We'll take just a short break. And again, the show is proudly brought to you by Calvo Enterprises, Ambrose Inc., IT&E, Coast 360, and the Bank of Guam. It's the KUAM News Takeover, Guam's favorite containing COVID. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.